yourself to ask or write your question in the chat box on the side. I, along with the other moderators, will be monitoring the chat and will ask on your behalf. If you have a question that you'd like to ask anonymously, please send a chat just to me. I'll ask it without using your name. The content and discussion in this presentation will necessarily engage with issues of human trafficking, which can include sexual and physical abuse. Some of the content will be emotionally, intellectually challenging to engage with. I, along with the other moderators, the presenters, and all others who are speaking, will do our best to make the virtual meeting a space where we can engage bravely, empathetically, thoughtfully with difficult content throughout this symposium. With the virtual format of this year's symposium, it's made it easier for people to join us from all over the US and even internationally. As an icebreaker, if you think you may be the person living furthest away from where we are in Richmond, Virginia, please write your location in the chat box. We've had participants joining us from New York, Florida, Alabama, California, the United Kingdom, Australia, Romania, and many other locations as well. We'd love to know where you're coming from. We'd like to acknowledge our faculty advisor and program director of the Human Trafficking Elective, Dr. Rigby, for her unconditional support and efforts to educate and train the community on human trafficking awareness and prevention. Thank you, Dr. Rigby. Before we introduce our first speaker, the co-director and faculty advisor for the Human Trafficking Elective, Cheryl Bodemer, would like to welcome you.
Welcome, everyone. We're so happy that you could join us today. If you joined us yesterday, welcome back. If not, and it's your first time joining us this week, we hope that you enjoy this seminar and also to help us, give us some feedback on what you think we did well and what can be improved for the future. But I'd like to welcome you on behalf of all of us. So thanks for joining us.
It's my honor to introduce our first speaker of the day, Bill Woolf. Mr. Woolf brings years of experience combating human trafficking in our communities and is the founder of JustAsk Prevention, a nonprofit based in McLean, Virginia, dedicated to fighting human trafficking through prevention, education, and raising awareness. In addition to founding and leading JustAsk Prevention, Mr. Woolf draws on experience from serving in law enforcement, leading the Northern Virginia Human Trafficking Task Force as lead investigator and teaching as an adjunct professor at George Mason University. In 2018, he received the Presidential Medal for extraordinary efforts to combat trafficking in persons. Mr. Woolf now serves as Director of Human Trafficking Programs for the U.S. Department of Justice. We are thrilled to have Mr. Woolf back. He and his team graced our first symposium and blew the roof off the house, so be prepared for another impactful presentation. Mr. Woolf, thank you for being with us this morning, and I'll now hand it over to you.
Well, thank you, Ben. Certainly, don't set your expectations too high, but it's a pleasure to be here with you all this morning or this afternoon. I see we've got some friends in the UK and Ireland, so it's great to see sort of the global engagement and really to talk today about a global issue, right? Human trafficking, but as it specifically relates to the pandemic, the issue that we have going on around the world today. As Ben mentioned, I serve as the Director of Human Trafficking Programs at the U.S. Department of Justice. And in that capacity, a lot of what I do is really to help coordinate the efforts at the state and local level all across the United States. And what is our response? I also had the pleasure of serving as Principal Deputy Director at the Office for Victims of Crime within the Department of Justice. And so this issue, and I served in that capacity for the past year. And really, this was an issue that was right at the forefront, as we struggled and strategized to really figure out what is our response, right? And really looking at how is the pandemic impacting human trafficking. I'll tell you that our first thought was that, well, we might get a reprieve from human trafficking, right? With the lockdowns and people having to stay indoors and social distancing and the limitation of certain things. Our initial thought was, well, maybe this will actually reduce the instances of human trafficking in the United States and around the world. But we found that through working with, and the Department of Justice funds 50 task forces around the country. And in working with our task forces, what we found is that the number of cases regarding human trafficking have either stayed the same or in some areas even increased. And of course, you know, the offenders, the bad guys, if you will, have done a very good job at adapting to the current environment. So today, what I'd like to do is really talk about three major impacts that the COVID-19 pandemic has had on the issue of human trafficking. And that is, one, the increased risk of human trafficking, the inhibition to identify victims of human trafficking, and then really how it's impacted services for victims of human trafficking. So I really want to talk about that, and we'll be trying to focus that context within the topic area of with the school lockdown and how it's affecting youth in particular. So talk for about 45 minutes or so, and then we'll open it up and answer some questions and engage in that fashion. So the first piece I want to talk about is the increased risk. This is something that we are seeing all across the board in all realms of exploitation, in particular child exploitation. With the limited movements and lockdowns and schools pivoting to being virtual in many states here in the US, we know that youth are becoming more dependent of being online. They're online for schooling purposes. They're online for social interaction, quite honestly, because they can't really get out and engage like they used to. And that's created a real problem for us. It's created a problem because as they're more and more online, traffickers can be more and more online, and they can be grooming and manipulating young people during this time when they really have a captive audience. We have seen an increased presence of grooming happening on various online games where there is a level of interaction, and there's several different platforms that are out there that kids are playing, even at the youngest ages. I know that you know, there's games out there that several young people, you know, kindergarten and even maybe preschool age, are able to play. And there's some level of interaction with other people. And as we know, when you are when you're online, you can take on whatever persona you want. And so we have adults that are pretending to be children, grooming young people. We've seen a massive increase in child sexual abuse material, some things such as child pornography and on live streaming of sexually exploitive material, particularly among children. So we know that this is going on, and it is certainly on the rise. And part of that is because there were several efforts prior to the pandemic to implement prevention, outreach, and awareness, right? There were several efforts to do so within the schools. The organization that Ben mentioned that I founded was based around developing and implementing prevention curriculum. But when a lot of those various curriculums were developed and implemented in school systems, there was never most of those were not developed to be delivered in an online or virtual environment. And so what we have found is during this past year, a lot of those safeguard measures, those things that were put in place to try to prevent trafficking or at least do some level of outreach to youth, are no longer in place. Because of the way that the virtual school environment is working, there just really isn't the room to implement these types of curriculum. So it's really left a gap or a hole in delivering this type of curriculum. And so we're starting to see where youth are becoming more risky online, and there's not a lot of monitoring that's going on in that capacity. So not only are traffickers having more access to youth, but also because of the lockdowns and the lack and really the social isolation, which is, you know, lack of ability for youth to interact with other kids and really build out those social networks, they are becoming more trusting of individuals online, and they are seeking other people out. The reality is, as human beings, you know, we all want to have that human interaction. That's just how we're wired. It's how our chemistry is set up. And when we don't have the ability to be interacting with other human beings, it really does leave a void and a gap. And we're seeing that as several reports are coming out now, discussing sort of the mental health consequences of the various lockdowns that are happening all across the world right now. And those are very serious and tied directly to the issue of human trafficking, because that is one of the predominant factors, societal influences that leads to young people being vulnerable to trafficking. And that is when they just really don't have a strong support network, right? And that is part of what the pandemic has done. Additionally, you know, I mentioned that we've seen instances of human trafficking increase or stay the same. And a lot of that is tied to the fact that the demand has increased. So when you look at our demand-based individuals that are purchasing sexual services, because they have more time on their hands, essentially, there is increased demand for these various services. And that's tied directly into the fact that it's much more difficult during these times to identify victims of human trafficking. So resources are being diverted. These resources, particularly law enforcement resources, are being diverted to address other issues. So now I think it would be remiss if I didn't mention, you know, the incidences of civil unrest around our country over this past year, as well as just sort of monitoring and supporting the various lockdown situations. Law enforcement's resources have been shifted. I know I talked to several folks, and in many police departments in states around the country where there are lockdowns, law enforcement are, particularly their investigative staff, are operating in a telework capacity. So they're not in the communities, in the streets, they're not talking to folks the way that they used to be able to do to proactively seek out human trafficking. Many proactive identification investigations have been suspended. Those types of operations have been suspended during the course of the pandemic. And so there is not so much of the deterrent factor and the folks on the front line that are able to interdict and come across these situations. So our law enforcement resources are really being stretched thin. And that is really allowing the trafficking operations and the various enterprises that are out there to operate with impunity. There's really no one to investigate them in certain areas of the country. Now, there are certain states where those operations are continuing. Those operations are, continuing at the same rate that they have been, and that's great. And that's how we have some information relative to the fact that it's not the instances of human trafficking are not actually decreasing, but rather increasing. When we talk about identification, also another major challenge to identification, particularly among our youth, is that they're not in the schools, right? Schools are really on the front lines of identifying youth that are being exploited or abused, because they have the opportunity to observe that child on a pretty routine basis. Oftentimes, teachers or at least school officials are spending more time with a child in a given day than the parents are. And so they can really see some of those changes and warning signs. And there's several organizations out there doing great work in training teachers and educators on how to identify human trafficking. But that becomes much more difficult to identify those types of things in a virtual environment. Many youth that are doing Zoom classes such as these, they can't see the children. There's like 4 people that have their cameras on, and several other people right now just in this session. It's very difficult to interact with individuals in this particular capacity because you can't see the reactions. You can't see how they're presenting physically. A lot of the warning signs and the visual cues that would be present in the classroom are not present in the virtual classroom. As it was a very weird year, just sort of a sidetrack, as Ben mentioned, I'm an adjunct professor at George Mason University, and so taught the class virtually in the Zoom environment this year. And the class looked very, very different than it has in past semesters, because I wasn't able, when you're in that classroom, I can see the students reacting. I can see, when there's certain topics that maybe I need to discuss a little more in detail, or we need to stay on top of, or, and also students also feel more, they're more ready to engage and offer, conversation in an actual classroom than they are in a virtual environment, right? Just because it's very difficult and it's not something that we're used to. It's not natural to work in this particular capacity. So those that are on the front lines, our teachers, our counselors, social workers that may be interacting with children, are not able to see those cues and those signs and symptoms, if you will, of potential trafficking and when it's happening. So that is something that can be very challenging, and it truly is inhibiting our ability to identify youth that are being exploited. Additionally, we talked about the fact that our law enforcement resources are being stretched thin, and even within the healthcare industry, we see where there were a lot of great efforts that were putting training into the healthcare facilities, right? And getting nurses and doctors and other healthcare professionals up to speed with how to identify suspected human trafficking cases. But with the COVID-19 pandemic, the lockdowns that have been put in place, the protocols that have been put in place, which are reducing sort of that patient-provider interaction, they're reducing that interaction, and a lot of times there are many people that are not going to see health professionals right now, right? They're not getting out and going for regular checkups and things. So we're having to really rethink how we approach this issue. And I can tell you from being in the human trafficking space and for such a long time, this is not something that we really ever talked about or planned for. How do we attack human trafficking when we're all sort of locked down or social distancing and not around each other, right? These are things that we really didn't plan for when we implemented some of this programming. And so it really is taking the community of professionals and experts that are out there to really rethink training delivery, and then procedures and processes that we can put in place to better identify potential victims that are out there. We do get very focused. One of the things that has always been true of many professions is we get what I like to call tunnel vision, right? We have our mission, and so if you're a teacher, your mission is to teach whatever your subject is, right? Math, algebra. If you are a healthcare professional, your role is to treat whatever the issue is when that patient presents themselves, right? Human trafficking is something that ties into so many different areas, and oftentimes professionals engage or interact with a human trafficking victim for some other reason. Even in the law enforcement space, police officers don't typically respond to quote unquote a report of human trafficking, right? It's usually something else that they're interacting with. And one of the things that we have seen is the pandemic, and sort of our response to the pandemic has really caused us to take 2 steps backwards, because now we are back to really having that tunnel vision and just dealing with the situation that's been presented with us, because we're trying to minimize that in-person interaction time, right? We're trying to decrease the spread of this terrible virus. And in doing so, we're not allowing ourselves to have that extra level of interaction, right? Oftentimes, human trafficking victims are identified because you build a trust relationship. You engage in some conversation with the individual to really kind of explore whether or not they could be potentially being trafficked. And we just don't have the time to do that anymore. And we don't have the, we're being told to limit our in-person interaction. So we don't really have the ability to do that. There are several studies that are ongoing to kind of codify what exactly the impact of the pandemic has been on victims of human trafficking. And a lot of that is really going to be focused too, as I mentioned earlier, on what has changed relative to the modus operandi of these organized crime enterprises. How are they shifting the way that they do business? And in the law enforcement space, there was a big shift several years ago when the Federal Bureau of Investigation was able to take down Backpage.com, which, as many of you probably know, was a huge spot that traffickers use to advertise for services. The FBI took that down, and so traffickers very quickly shifted how they did business. And so we're seeing that now, but we're not really sure what's going to come out on the other end of this. And is this going to be sort of a permanent change to the way that traffickers do business? Or is this going to be something that is more temporary and things will go back to the way that they used to? The pandemic has also had massive economic impact to various communities. And we know that many people have lost their jobs. We know that, many people are suffering. And with, when you have situations of poverty, homelessness can be certainly tied into that. We do know that those are increased risk factors, right? So they create unstable home lives. They create people that then become desperate and allow them to be more vulnerable to the tricks of the traffickers. And so that is certainly of extreme concern when we talk about human trafficking, and that is, the widespread job loss leading to homelessness, instability in the lives of young people and families, for that matter. We also know that in those situations, because of stresses that parents face in those situations, it can create environments where children are abused by the parents, right? And we just know that those are inherently tied together. So we see an increase in child abuse from the familial perspective as well, which can very much lead a child to be more vulnerable to trafficking or being trafficked by the parents themselves as a means of survival and a way to continue to provide, to put food on the table, really. So we have this, this increased risk based on all of these various factors, economic factors, social isolation, et cetera. We have the challenge of actually identifying potential victims or those that are being groomed. And then the last area that is really being impacted is victim services themselves. So two areas. One is access to services. So because movement is being restricted, because there's not a lot of outreach efforts that are going on right now, one of the things that we are seeing is victims just do not have access to services. They don't know how to get the help that they need when they're in abusive and exploitive situations. And we also know that many of these victim services organizations are really struggling. They're struggling because they were never prepared for a pandemic either, right? This was not things that many folks were really kind of strategizing and preparing for. So they don't have the policies and procedures in place to protect their employees or to thinking about shelter environments. How do you protect the clients that are in the shelter and prevent the spread? Because nobody wants to be an organization that's responsible for an outbreak. I think the terminology is, to be a super spreader, if you will. So a lot of these victim service providers have closed their doors. They've shut down or suspended services, and trying to deliver the unique set of services that are necessary in the human trafficking space virtually just does not work. And so that's something that people are really struggling. Plus, you have a lot of different considerations when we talk about service delivery. One is client confidentiality. How do we ensure that if I'm a client of human trafficking and I come to you for services in this virtual environment, how do I know that you are securing my information, right? Or how do I know that it's truly a private conversation that we're talking about? And so that's something that is really, really important, is how do we virtualize these services? For those of you that are in the healthcare profession or studying to enter the healthcare profession, for the past several years, we've been working a lot on the delivery of telehealth and how do we do that? I know personally, my doctors, the group that I'm with, they prefer that you kind of do as much as you can, like online or virtually, before you come into the office. And that has only been exacerbated by the pandemic as well. So again, we're limiting that in-person interaction and trying to do things virtually, which again goes back to inhibiting identification. But that technology, to be able to do that, is very expensive. And so for a lot of these service providers that are operating on very tight budgets and are reliant on grant funding and donations, just don't have the ability to adopt and adapt this new technology. So that's really a struggle for them. And that brings me to another point, and that is just the financial resources to continue to deliver these services. Many of the victim services organizations that we work with, and then in particular the Office for Victims of Crime supports through grant funding, have really struggled because they don't have the ability to hold the typical fundraisers that they have in the past, right? So they can't have the galas and the in-person events where they can really raise the funds that are necessary to support these victims of trafficking. So financial resources are a huge strain right now for these organizations that are doing such incredible work, and they can't really get out into the streets or do any of the outreach that they have been doing before. So this is a real struggle. At the Office for Victims of Crime, we've been monitoring this. We have seen the calls into hotlines increase significantly over the past year. Many of the hotlines are now reporting, not just the National Human Trafficking Hotline, but domestic violence hotlines, sexual assault hotlines, are all reporting that they are seeing massive increases, and they're not able to sustain at the level that they are. So they're really looking for ways to expand their services, but they're really struggling in that regard as well to keep up with the demand for services and intervention. A lot of the social isolation issues have left victims. Part of the issue with human trafficking is that many victims oftentimes feel helpless or hopeless. They don't have the ability to they don't feel like they can get out of that particular situation. And so many of the victims that are out there now, this pandemic and the social isolation is certainly making that situation much worse as well, because they just feel, once they get stuck into these situations, they just feel like there is no hope. There is no one that can really help with this particular situation, and they don't know where to turn to, because a lot of the public outreach and awareness events have really been shut down and are not very active right now. So those are really the main issues relative to what's happening right now in the course of this pandemic. Some other things that we know of is, with the mask wearing, it does make it more difficult to identify people. It makes it more difficult for law enforcement to identify folks. I would caution in this particular space, there are some statistics that are floating around. One in particular is that you are 667,000 times more likely to be trafficked than you are to catch COVID or something like that. I will caution that a lot of those are sensationalized, not based in fact. But we do know that the threat of human trafficking does remain. It very much is serious, and we continue to study and evaluate the field to try to figure out how we can best support them. The Department of Justice invested last year over $100 million in grants to support organizations that are doing this work. And we will be investing the same amount this year in 2021 to organizations specifically looking at providing for housing, providing training and what we call technical assistance to organizations that are working in this space. We did launch last year, I'm very excited that we were able to launch a program relative to prevention. So the Department of Justice is funding the development of prevention curriculum. And as part of those conversations, we'll certainly be driving that they develop that to be delivered in a virtual capacity, right? So to try to fill that gap or that hole that we have now with the inability to deliver those services virtually. We have the housing program. We do have an economic empowerment program for victims of human trafficking that we'll be funding this year to provide jobs training and connecting human trafficking victims to appropriate jobs. Expecting a human trafficking victim to be able to just integrate into the workforce is an unrealistic expectation. Many of them require we need their employers to really be victim-centered and trauma-informed in their employment. And we also know that many victims of human trafficking, just because of their experiences and other things, they need jobs that are very empowering, right? They need jobs that make them, not that they have to be the boss per se, but they need to feel in control, right? And that's a direct result of being controlled for such a long period of time. So really connecting them to appropriate employment and not just trying to throw them into the workforce and say, go get a job, right? We know that doesn't work. So the Department of Justice will certainly be investing in supporting that. As well as making sure that we are investing in organizations that can provide other services and are able to pivot in this time of the pandemic to really be able to deliver services in a virtual environment and to be able to do some of this outreach. All indications on our part is that we will have to continue to operate in this posture for several more months at least. And we are really trying to gear up and make sure people are prepared, because we don't know when this might happen again, right? And so we really got caught unprepared this go around. And so we want to make sure that moving forward, we have a component in the development of our overall response. This past year, the federal government launched the first ever national action plan to combat human trafficking. You know, it's great that we have the action plan. A little crazy that it's 20 years after the passing of the Trafficking Victims Protection Act that we finally have a national plan to attack human trafficking. But in that plan, it is really directing federal agencies to build up capacity around these different areas. And that national action plan is built around the 3 pillars of the Trafficking Victims Protection Act, which are prevention, prosecution, and protection. And really, it is really a coordinated whole of government approach to leverage all of our resources at the federal government level to deliver that out into the field, to support the organizations that are out there and provide them with the resources that they really need, particularly the financial resources, which is probably one of the biggest gaps right now, is really just the investment into the anti-trafficking efforts. So some of the recommendations or things moving forward, aside from just the investment piece, is just continually monitoring what the impact is. And we expect that to continue to evolve and to see what the negative impacts really are, and make sure that we're delivering that information to the field so that they can be responsive to that. Also ensuring that there is still access to justice for victims of trafficking. That is very key right now. And justice looks different in different environments, right? So justice is not just the offender, the trafficker, being prosecuted, right? Justice can be interpreted through various different means, and it should be dependent upon how the victim views justice, right? So we need to make sure that we're including the victim in that process. Making sure that we're investing in our law enforcement and giving them the skills, tools, and resources that they need. One of the biggest issues that we see with law enforcement across the country is a lack of intelligence gathering or ability to really conduct analysis of what's happening within their communities to direct their investigations, particularly in a current pandemic and even in the post-pandemic world. And helping our service providers remain flexible, as well as making sure that we are doing a good job with data collection. That's an area where we've really been poor for the past 20 years, and that is collecting data around the issue of human trafficking. So there are efforts underway at the federal government level, but also supporting some non-governmental organizations in this space in developing data collection standards, as well as conducting some studies around prevalence relating to human trafficking. So I want to pause there and see if there's any questions and engage in some dialogue with any questions that you might have about what we've talked about up to this point.
And we have a number of different questions in the chat on the side. So the first one was, as resources are being shifted elsewhere, how are law enforcement anti-trafficking groups tracking incidents of human trafficking, and how is the demand for this specifically tracked?
Yeah, that's a great question. So what we know is that many law enforcement agencies are, they're redirecting their resources to other priorities within those police departments. So what that means is that they're still responding to reports of human trafficking, but those are few and far between. The real impact as it pertains to the way to really attack human trafficking from a law enforcement perspective is to be proactive. And because many law enforcement agencies are redirecting resources, or their investigators are working in a telework capacity, they don't have the ability to be proactive, to be going out and setting up stings to interdict incidences of human trafficking, or to develop sources of information to really guide their investigations. So that is, that is a real challenge for law enforcement. So how are we tracking those various things? So there are a couple, particularly with demand. Most of that is being tracked through a couple of non-governmental organizations that are doing some work in this space, and they are monitoring, some sort of the online advertising that's going on. There are efforts. I don't want to get too into detail and speak for other organizations, but there are organizations that do post false advertisements and then are sort of measuring the response of those, and they have seen those calls, if you will, stay the same or increase. So a lot of that work is being done currently, but by non-governmental organizations and not the federal government.
And I'm just going to move through these questions in the order I have them. So I have one from the anonymous chat that would like you to highlight some specific strategies to help educate and prevent children from becoming victims of child predators and sexual exploitation.
Yeah, great idea. So I would say some of the things that you can do is you can partner with some of the NGOs that are out there. One of the best ways, one of the things that is the best way to communicate nowadays, obviously, is through social media. That's how a lot of people are communicating. So what I would encourage is to find a reputable organization. And I just caution you because there are some organizations out there that over sensationalize the issue of human trafficking. Some of the statistics and facts and things that they put out there are not accurate by any means. So you definitely want to make sure that it's a reputable organization. And just sharing things on social media, right? If you have access to younger folks, whether it's through a faith-based group or you do some work in the school systems or whatever, sharing that information. There are organizations that offer programs like the organization I founded, JustAsk Prevention. They have an ambassador program where they will give you the materials and do sort of a train the trainer, so you can go out into your community and share things, even hosting a virtual event where you share this information. The more information that we can get out there, the better. And then supporting those organizations that are doing the work and helping them to be able to virtualize their efforts, I think are the best things that we could be doing right now.
And our next question is, what do you think are the most important or effective questions for healthcare providers to ask patients when seeing them via telemedicine, if there's a suspicion or abuse of trafficking?
That is a great question. I don't know if I can summarize it, in this platform. I would be happy, though, if anybody wanted to send me an email, follow up on that. I'd be happy to connect to some resources and some organizations that are working in that space that can provide you, with sort of a checklist, things to look for, even things that you might be able to view through telehealth. In particular, I think in the healthcare sector, a lot of it is thinking about signs and symptoms, right? So instead of just diagnosing, very similar to, as I'm sure many of you, know with the domestic violence piece, right? So somebody comes in with, a black eye and they say they tripped and fell and hit the doorknob, right? That's going to be a little bit of a red flag. And as a healthcare provider, you're probably going to ask them additional questions around that and really make an evaluation. So with the human trafficking space, there are similar signs and symptoms that we need to be looking for, ways that victims will present to a healthcare provider. There are some resources that I'm happy to share, and some training that they might want to access.
Yeah, that would be great if you could share the resources with us, because I'm sure there's probably many of us on this call that would be interested.
Absolutely.
Our next question is, how wise is it to teach human trafficking to youth virtually, as the content can be triggering and the student would have no one to immediately turn to?
Yeah, that's a great question, and I think that goes to the development and delivery of the content, right? So a lot of organizations that were delivering this type of prevention curriculum in person, as part of that, at least I know some of the school systems that I worked with, part of that training was that you would have school counselors available, right? And so you would deliver the curriculum. If a child reacted in any sort of way, that counselor was aware, trained, and immediately respond to that situation. So this is an area where we really have to adapt in that virtual environment, right? And we really have to be looking at how do we develop appropriate curriculum, because you don't have that in-person reaction to. So this is an ongoing conversation where we're really looking to engage, some mental health professionals, child development professionals in this particular space, along with the curriculum developers, to figure out how do we do that, ensure that if a child is, responds or needs help or needs intervention, that those protections are in place, and that the school district or whoever's delivering the curriculum is prepared to respond to that appropriately. That's a great point.
And then I have another question from the anonymous chat. I understand we are in the learning states of this new wave of online grooming, but how can we tackle the issue of online enticement right now with the information available?
Yeah, that's a great question. I think there is much to be learned, and we certainly need to be shifting our focus and attention there. If we're talking about our youth, I think there are, one is really thinking about revamping how we go about internet safety. So one of the things that I hear from so many young people is they're tired of hearing about internet safety, right? They're tired of hearing about it, but what we know is that it's not necessarily effective, right? Because we're seeing instances of online exploitation increase. So what does that tell us? It tells us we're doing something wrong, and I think we need to go back to the drawing board and really look at that. What we can do is we can at least be having the conversation, right? So I think one thing that is really important is that we are letting young people and parents know that these threats exist. You think about, I've heard from a lot of parents and had some interactions where, they're now of the mindset, well, my child's not at risk because they're home all day, right? And so because they're in my home, they're in a safe place, they're not necessarily at risk to being groomed by traffickers, and they're not understanding, the parents are not understanding the online threat that exists. So parents need to be extra vigilant, in my opinion, during these times. They need to be engaging their kids in conversation regularly, take an interest in their lives. Had a conversation with a group of parents the other day and said, look, when your kid was going to school every day, they would come home and more than likely you would ask them, how was your day at school? What did you do? Who did you talk to? Just normal questions that parents ask their kids, and they're engaged in those lives. Well, we're seeing that not really happening now, because they know where the child's been all day. They know what the child had for lunch because the parent made it for them, right? But we still need to, I think there does need to be some education and some push on parents right now to really engage, maybe in a more meaningful way than they have in the past.
Our next question is, I've read that victims have been identified in every high school in Fairfax and Prince William counties. These counties have teen trafficking prevention programs. How do you convince other school districts to implement prevention programs in their schools?
Yeah, that's a great question. One of the things that I hear from so many people working in this space is, it's a no-brainer, right? It's human trafficking. Why would you not want to prevent it, or why would you not want to put it into your school systems? Believe it or not, it truly is a challenge, right? Because many of the school systems, their response is, well, we don't have a problem here. And so instead of, I think about a year and a half ago, I was at a roundtable with representatives from Europol. And in talking to them, we were talking about, in general, the United States' response to human trafficking. But one of the things that they brought up in that conversation is they said, and this is the Europeans saying, you all in the United States, you're very reactionary, and it's oftentimes a knee-jerk reaction. And it really struck me, and it's a valid observation in the sense that, we wait for a problem to present itself before we respond to it, instead of trying to get out in front of it. And the problem with that is, in response to anything really, is that we're behind the 8 ball, right? And now we're always trying to play catch up. But that's just, for some reason, it's part of our culture. We don't want to invest in something until it's an actual problem. Even though we know that human trafficking is pervasive all across our country, many places don't want to get involved. The other sort of objection that I have often heard from school districts is, well, parents are not going to like this. Parents don't want to have this in the school system. I've found that to be the exact opposite. Once parents learn what human trafficking is and they learn about the availability of prevention curriculum, they all want it. They want it in the schools. And oftentimes the question to the school district is, why didn't we have this earlier? So I think that's a really long way to kind of answer this question, but I think the answer is really through the parents, right? Educate parents through, PTAs and other organizations, get them motivated, and to go to the school board or the superintendent or whoever and say, look, we want this in our schools. Let's get this done. But I think it's a hesitancy because we are very reactionary. And the other is because there's just this fear that parents are going to be upset that we're talking about the issue in our schools.
During the pandemic, many organizations have found that resources we have developed may be useful in non-pandemic setting, such as increased telemedicine, the use of virtual conferences, etc. Have you identified anything that has been developed out of the necessity in the pandemic that you think will be beneficial long-term with respect to human trafficking?
So I think if there's a silver lining in any of this, it is that we have adopted some new technologies. And we have become more proficient with online platforms, such as Zoom, where we are today. And so look at just the benefit of this conversation here. We have folks from all over the world, all over the country, that are able to be brought together in a very sort of economic fashion, right? We're not having to pay for expensive plane tickets and hotel rooms and other travel costs, where we can still share this information. So I think that really thinking about how can we best leverage the technology that has been developed during the pandemic, our proficiency with video communications and chats and other things, and really developing out these online platforms. The one deficiency that I find with the online platforms is the inability to interact and network. And I find that is a key component to conferences, even among youth. So the organization I founded, JustAsk Prevention, has an annual Youth Cares conference, and it's really targeted at high school and undergrads to sort of tailored towards them. And they were able to deliver that conference this past year, and were able to do it virtually, but it was a challenge to really make it interactive, right? And we do find that when things are interactive, we learn better, we retain the information, we process that information better. So I think we're at a good start of understanding the technological capabilities that we have. I think the next phase is really figuring out how can we leverage these technologies that we have developed to be much more interactive in a larger setting.
And our last question in the chat right now is, I feel that many of us have a set idea of what someone being trafficked looks like. However, I have read so many medical notes of patients retrospectively stating that they think they may have been trafficked in childhood, but just didn't show any physical signs, especially those with family involved and who had many components of a normal childhood. What are some things other than physical signs we should look out for when talking to youth and parents?
Yeah, that's a great question. And so, I think in particular in the healthcare setting, I think that, again, I think that would best be answered by sharing some resources that you all can reference. So certainly, when we think of physical signs, we're thinking of, signs of abuse, right? So lacerations, bruising, broken bones, other things. In the human trafficking space, those signs may be more subtle. And a lot of it, honestly, is going to be through conversation and appropriate questioning. So I know a lot of, in particular, pediatricians have started adopting a screening tool to screen for the potential for suicide, right? Because there aren't physical signs that somebody is having suicidal ideations, right? So I think that's really what needs to be adopted in the human trafficking space as well, is really a screening tool that is based on some non-invasive, non-direct questions. You can't just ask somebody like, are you being trafficked? That doesn't work, right? But those tools, some of those screening tools have been developed and are currently in the process of being sort of reviewed, peer reviewed. But I think there's room to improve upon those tools. And then really looking for the way to get that out into the healthcare field, right? And to deliver that and make that part of the standard practice of asking at least some of those initial questions to determine if we need to investigate further.
What can you say about peer-to-peer education on human trafficking, i.e. students teaching other students about teen sex trafficking? Is the impact better?
So I am, there may be some disagreement with my position on this, but I'm a huge fan of peer-to-peer education. I think that in my experiences, youth listen to youth, right? And they know how to best communicate. They don't really want some, old guy standing up in front of them, telling them, kind of lecturing to them. That's not the best way that they receive information. And I think the other thing about youth is, there are huge generational gaps, right? And the way that my generation receives information is very different than the upcoming generation. And so, I think there's and I mentioned, sorry, that was another presentation, but so the organization that I came from, JustAsk Prevention, they have a student advisory council, and that council serves to really inform the work that they're doing, but they also do some outreach efforts themselves, and I think you actually be hearing from them next. I think that is the next presentation. I'm a firm believer in that. I think that we need to do more peer-to-peer education. It shows investment in the cause. It motivates others to get involved. It shows a sense of community responsibility, which I think is really important. And so I'm a big fan.
Yes, that's correct. The Student Advisory Council will be presenting at the next session at 11:30. And I have one more question in the chat. I have had some providers express apprehension about screening for human trafficking for fear of retribution by the trafficker. Can you relieve our fears?
Absolutely. Yeah. So, can I say that retribution will never happen. I can't guarantee that, right? Like nothing's 100%, but the likelihood is very low. I can tell you during my tenure in law enforcement, I never had a trafficker. What we have to understand is human traffickers are all about profit, right? And so when a situation becomes inhospitable, they're going to cut ties and walk away from that, right? So they don't want to draw attention to themselves. They don't want to draw attention to their enterprise. They just want to make money. And so, if a particular victim is drawing too much attention, they're probably going to cut ties with that individual, right? If a provider is identifies somebody and sort of an investigation ensues, you're going to see the trafficker kind of disappear, right? They're going to get out of town because they don't want to be caught. So I would say that the chances just really, the likelihood of a trafficker coming after a provider for trying to intervene, very, very slim, especially in a professional setting, right? If they're just doing their job, then the trafficker is going to try to get away from that situation and not engage and make it worse.
And that's our last question in the chat. So if anyone else would like to ask a question, feel free to unmute your mic and ask, or put it in the chat.
Mr. Woolf, I had a question. You mentioned that law enforcement has been more focused, or some of the resources have been drawn towards some of the civil unrest and other events going on this past year, especially. Do you see big differences in human trafficking based on like geographic location and police involvement in like certain neighborhoods? And this is maybe a separate question, but do you also see big differences based on racial identities as far as both trafficked persons and traffickers?
Mm-hmm. Yeah, good question. So let me work backwards. So as far as the racial inequities, typically what we see is there tends to be a correlation between the demographic of the population where the victim originates from and the number of victims. What I mean by that is if it's a predominantly, if it's a community that is predominantly African American, then the majority of the victims are going to be African American. If it's a community that are predominantly Caucasian, then you're going to see Caucasian victims, right? Like it's just there is a correlation between the demographics. Most traffickers are non-discriminatory in the sense that they're not necessarily seeking out a particular person based on race, ethnicity, or anything like that. They're opportunistic. They're looking for access to the victim. They're looking for ability to mentally manipulate through suggestibility, and they're looking for some vulnerability that they can take advantage of, right? Unstable home life, maybe it is a poor economic situation, maybe it's past childhood abuse. Those are types of things that the traffickers are looking for to take advantage of. We do see, as far as where we see concentrations of some of the activities, so the recruitment component and where victims come from, that really can be from any community across America, right? And we're seeing that even more now with the online component. So traffickers, they don't have to be in a particular city or town. They don't have to be in Richmond, Virginia. They can be in, wherever in the world and still be sort of grooming and recruiting people online, right? The activities, particularly the selling of the sexual services, do tend to be in areas, well, it's driven based on demand, right? So you are going to see that in more densely populated areas where there is a concentrated demand base.
Hi, Bill, it's Faye. Thank you so much for joining us. It's always a pleasure to have you. Do you think we will ever end human trafficking?
That's a great question, Faye. So I say I feel obliged to say yes. Is it a long road ahead? Absolutely, right? I think there's a lot of work to be done, and I think there are pathways to ending human trafficking. I truly do believe that. I think there are things that we can be doing. There are societal determinants that lead to being at risk for trafficking, and I think that we can address those, right? And I think if we're willing to address them at the root cause, the key to all of this, going back to what I said before, is we have to stop being reactionary. We have to stop waiting for there to be victims and then responding to that victimization. And we have to get out in front of the problem and really, truly understand what makes a person vulnerable to trafficking, and then stopping that, right? And that's hard sometimes, I think, for professionals. Again, we go back to that tunnel vision, right? And I think that exists in so many different capacities. So when we're working in the human trafficking space, we're so focused on the actual issue of human trafficking and not so much of those precursors or those social determinants that lead to trafficking. So we really have to expand our view. We have to be willing to think outside of the box and really proactively and aggressively get out in front of it. If we're willing to do that, if we're willing to invest in it, if we're willing to, invest our financial resources as well as our time and energy and other things into attacking it that way, yes, I think we will end human trafficking. If we continue to remain in a responsive posture, then no, it's going to continue because we're never removing those things that lead to somebody being victimized. We're just responding to them after the victimization has already occurred.
I completely agree with you that prevention is the only way to end this. I just feel that, you got to get people to know how to protect themselves and prevent themselves from being exploited in the first place. And, when we just talk about demand, and the buyers, it's insatiable. I mean, it's bottomless, the demand for cheap or free labor or illicit sex. I mean, child pornography, that alone is through the roof. So as long as this demand exists, unless we go upstream with prevention, there's no way we are going to end this. I mean, we could mitigate the problem. So I just have a problem when people say, let's end human trafficking. I think it's just a myth. I don't think we can do that without more prevention, uphill solutions. Which leads me to my push for a public health framing of human trafficking, because the strength of a public health framing lies in prevention. And we're currently using a criminal justice framing, which is, mostly downhill solutions. Our solutions are focused on after the trauma has happened, so we can continue to throw money at victim services, at prosecution, at protection. However, that's not sustainable. We really got to spend more money on prevention, going uphill. And so, there is a push to frame human trafficking through a public health framework. And it doesn't mean that we're going to knock criminal justice out of the circle. It just means that we're going to encompass all disciplines within that public health framework so that we're fighting it through a lens of public health and through a lens of prevention. But I think there's a lot of resistance, especially from criminal justice, because I guess when you frame a problem through a certain framework, that's what's going to influence policy and funding. And I think criminal justice doesn't want to lose all that funding. And so I don't know, do you want to react to what I just said?
Yeah, so there's there's a lot of truth in what you're saying, and what I mean by that is I agree with it. I think that really it takes a holistic approach, right? So to your point, which you made probably much more eloquently than I can, you still have to prosecute the offenders, right? So there is a role for the criminal justice system. But I think part of the failure, and I do agree with this, and I will say this as a former law enforcement officer, there is too much reliance on the criminal justice sector to solve the problem,
Yes.
right?
Yes.
You've really got to get out in front of this. And honestly, I would extend that even to, the healthcare sector, right? I think, they're not necessarily out in front of it either. The healthcare sector is in a responsive posture because it's after it's happened, right? It's after the exploitation had happened. We have got to get to the root causes, and we have got to get to what is happening in our society that is allowing for demand, that is driving the demand. What causes that? Certainly, I have my thoughts and opinions on that for another time and place. And what are we doing to properly prepare young people? Even we talk about even the young adults that are manipulated into these situations. What did we do for them during childhood development to prepare them for this particular threat? Right. And I think that's part of the problem too. And I agree with you, Faye, like if we're not willing to go upstream and build the dam, we will never stop the waterfall. So
Yeah.
And it looks like there's one more question in the chat box. How could demand be more effectively addressed? We just have a few minutes left.
Great. So not to take 2 steps backwards, but I do think the criminal justice sector could increase penalties relative to demand. I think that there's not necessarily the criminal deterrent that exists around demand right now in many states. In Virginia, for those of you in Richmond, it's still a misdemeanor crime, right? And predominantly handled by a fine. Is that really a determinant, right? Are you really gonna be deterred if your fine's $500? Probably not. So I think we do need some stricter penalties relative to demand. But I also will go back to some of the social determinants there. And again, probably a much longer conversation for a different place. But why is there? I think we need to understand why is there demand for these services, right? Why are people willing to pay money to engage in sex with someone that could very well be a minor, or really with any person? Like, what is driving that in our society? And I think there are ways that we can address that piece as well. Again, I think we've got to get pretty far upstream to do that, but there are ways to do it. We just have to be more proactive. And if I'm being completely blunt, we have to be willing to have that conversation, right? It's an uncomfortable conversation to talk about some of these issues, particularly when we start talking about sex and what drives that and the desire for it and other things. But we have to be willing to have that conversation, and then I think we'll be able to really impact the demand piece as well.
Thank you, Bill. Well, that was awesome, always, and always when we have you. Very, very informative. It's 11:15. We want to thank you for joining us, Bill. And if you're ever in Richmond, please come and visit.
I will, for sure. And I want to thank all of you for taking your time. Not the happiest of topics to talk about on a Friday afternoon, but I do appreciate your time, your engagement. If there's anything that I can ever do to support you all or provide resources to you, please don't hesitate to reach out. I'm happy to help in any sort of way, and I just encourage you to help spread the message.
We will. And I will take you up on that offer, Bill. You know me. Okay, thanks everybody. Ben, do you want to do the survey?
Yes. And so one of the participants also asked about the resources. So if Mr. Wolf could send the resources to Faye, we can use all of your emails that you registered through Eventbrite and send the resources out to you all. And then the last thing is some logistical aspects. So the next presentation is with the Student Advisory Council, and they will begin at 11:30. And this is in a separate Zoom link. So Gurgis just put the Zoom link into the chat. So you're welcome to copy and paste that link to get to the next session, or you can also use the email you received from Eventbrite or Faye. And then I'll share my screen and let you look at the survey link. And so this is the survey for the whole symposium, but also today's session. We'd really appreciate your feedback. It helps us make the symposium better each year. So the survey is designed to be taken after your last session. So if you plan on attending more sessions today or tomorrow, you can take it after you finish your last session. But if you'd like to provide immediate feedback now for this session, you can also use the same link. So you can either look at the URL in the chat or you can scan the QR code with your phone. Thank you.
Someone asked